We praise the Lord that He has appointed people to go into areas in which they have not heard the good news of God, to bring them the gospel. And those people who have been sent to Vietnam and other places, and we rejoice this morning that we have Dr. Bartholomew who came to South Florida to share of what the Lord has done through their lives. We welcome Dr. Wing to
share a little bit about me. I grew up in a Buddhist family, and after I came to America, the church in America sponsored our family. And at that time, I came to know the Lord. And when I grew up in the Lord, I went to summer camp, Christian summer camp. And that is how I meet Pastor Phiên and know the family of cô Thanh Vân and Pastor Phian's wife. And through the summer camps, we were able to meet each other. And in the last summer camp in Ohio that I attended, at that time I was in high school. And at that time there was a missionary who came to preach at the camp. And he called on the young people that whoever wants to offer their lives to the Lord, then I stepped up, and he prayed for me at that time. But after I came to know the Lord, and when I was about 13 or 14 years old, God had called me to be a missionary. And I knew at that time, at 13 or 14 years old, I knew that when I grew up, I would be a missionary. But my dad said, why don't you study medicine? And I knew that when I grew up, I was going to be a missionary through medicine. When people ask me what Bible verse, it's really important in your life when you go serve the Lord. And the verses of my families is in Matthew 25, verse 35 to 40. For I was hungry, and you... Okay. For I was hungry, and you gave me something to eat. I was thirsty, and you gave me something to drink. I was a stranger, and you invited me in. I needed clothes, and you clothed me. I was sick, and you looked after me. I was in prison, and you came to visit me. Then the righteous will answer him, Lord, when did we see you hungry and feed you, or thirsty and give you something to drink? When did we see you a stranger and invited you in, or needing clothes and clothed you? When did we see you sick or in prison and go to visit you? The king will reply, I tell you the truth, whatever you did for one of the least of these brothers of mine, you did for me. To share a little bit about my family, my husband is an oral or maxillofacial surgeon, and I am a family practitioner. And currently we are living in Ohio. After we married, we have lived in many countries in Africa, as in Gabon, Niger, Mali, Guinea, Chad, Cameroon. And before I married, I worked also in Cambodia. And so often we go back to Cambodia to visit the church there. And in the last 2 or 3 years, we have gone many places, such as Ethiopia, Burundi, Sierra Leone, Zambia, and Benin. I'm not sure if you know much about Africa. This is Africa, and we have pretty much traveled throughout Africa, as you see in the map. After marrying, I followed my husband to serve the Lord. Although I was a family practitioner, yet I became a anesthesiast, so that he can operate on the patients. We would work during the daytime, and at night we will be on call. And if we have time, then we will have time to play with our child. A lot of people ask, how did the two of you meet? And after studying medicine, I went to work. First of all, I went to Vietnam. When God called me to serve the Lord, I figure Vietnam is the easiest because I know how to speak Vietnamese a little bit, and I don't have to go and study another culture, another language. And then I went to, in 2000, there were difficulties when there were changes. When, from 1999 to the year 2000. So a lot of people in Tam Kỳ in Vietnam, they thought that we were CIAs. And so we stayed there for 3 months and we couldn't do much because at that time I was serving the Lord. And I wanted to go to the United Emirates and serving the Lord there while I wait for the paperwork to go back to Vietnam. But after 6 months in the Middle East, Vietnam did not allow me to return. And so I went to Cambodia and served the Lord there. And I served in Cambodia for 5 years before I met my husband. And Tim served the Lord in 2003. He wanted to go to Africa to see how Africa was. And after 2 years of working in Africa, God called him to return to Africa. And in 2004, we worked with CMA, and they had conferences for people outside of America. And so in 2004, we met each other. And after that, Tim went back, and the Lord allowed me to go to Cambodia. And most of the time, we were communicating through email. And after that, we married in 2006. And I met my husband 3 times. And the 3rd time, he went and asked my hand in marriage. And the 4th time, we married. And it was very quick. And we didn't see each other often at all. I got married when I was 40 years old. And after that, we asked to adopt a child from China in 2012. A lot of young people who are not married yet, I would like to share with you that when I went to serve the Lord, I went there to keep on working. And it's very hard to meet a husband. And so I prayed to the Lord that when I go serve the Lord, He will provide for me a husband. And the first prayer that I asked of the Lord is that person, that husband to be, will be a believer of Christ. But I did not want that person to stay in America. I wanted that person to serve the Lord in a country outside of America. And thirdly, I asked that person will be in medicine because I was serving in medicine. So if there are any questions, we can communicate with one another in medicine. So we asked the Lord one more time. I asked also the Lord because I enjoy surgery. So I asked for a surgeon so that I can perform surgeries with him. And so the 4 things I asked for. And I also asked the Lord because I enjoy having blonde hair and blue eyes. So as I was waiting for my husband, when he came, I knew exactly that this was the man that God had called me to be my husband. And I knew right away. And so I like to encourage young people who do not have a husband or wife yet, pray. Pray very in detail. And however you pray, God will give to you the person that God you asked for. And every time we go somewhere, my husband, he's a surgeon, so he has to carry a lot of things so that he have enough supplies. This is Mali, Africa. We were there for 2 years, and this is the operating room. It is not clean as over and sanitized as over here, but we try to keep it as sanitized as possible. Because sometimes we go and operate, and there's flies, mosquitoes flying into the operating room, or the operating room has no AC. So when we operate, we sweat. And these are some things that you should not have in the operating room. First of all, on the top picture, there's only one operating room. So when my husband performed surgery, about 6 to 8 hours. And when they have to operate for pregnancy, they have to bring in another bed, and the two beds are side by side like this. And the picture of the person on the bottom is the one that was helping Tim to operate. He was the assistant. And at the beginning, he was standing, but then he was sweating so much. And then he sat, and then he passed out. Because I don't know why he passed out, but in the end we found out that it's because he did not eat breakfast. And so we had to bring in some food for him, feed him so that he can recover. And sometimes we cannot find a babysitter for children, so we have to bring in kids into the operating room and let them just sit there. And we told them, don't touch anything that is blue. And sometimes they would come into the operating room. And sometimes my daughter wanted to see what her dad was doing, so she would come and just watch. We see many types of illnesses over there because there is no oral facial surgeon, doctor. So oftentimes they just go to their own medicine doctor to be healed. And oftentimes they think that it's Muslims. So they think that Allah is their God who will heal them. Or if He gives them this illness, they have to live with it and they cannot change from it. And those who would come and use different herbal medicine and different types of ways of medicine, but it doesn't heal them. And oftentimes, most of the time, when we go, Tim can operate like cleft lips, where lips are open, and so many hospitals will bring people to him, and we have to see who can be operated on which day. And maybe within a week, we would operate about 30 to 40 people. And sometimes we don't have enough time to operate, so we just have to send them home. These are some cleft lips. When we asked for to adopt a child from China, Alex also had a cleft lip, and she was also operated on. These are pictures of us in the hospital. I'm not sure if CMA Vietnam has heard of PACS. PACS is Pan-African Academy of Christian Surgeon. Dr. Thompson. He is the missionary doctor in Gabon, and he is a surgeon, and he started in Africa some hospitals of Christian hospitals, and he also started to teach the doctors in Africa to operate. And after 5 years, they would stay in Africa to help their people. And so we also worked with these residents, those who are learning and practicing. And so we focus on, Tim focused on orofacial surgery, and I focused on delivery of babies. And this is a woman who was living in northern Cameroon. And this is the story of this lady. She lived there, and there was war, and she was shot in the face. And after being shot in the face and was healed, she could not open her mouth. So when we were in Cameroon, she came down to meet us and to ask for our help to open her mouth so she can eat and talk. And so after that, she went back to North Cameroon, and she heard the gospel of Christ, but she was still hard-hearted, and because her family was Muslim. And at that time, there was a Cameroon pastor was called to go to North Cameroon. And at that time, when we were leaving Cameroon, he was on his way to Cameroon, and we met him there. And after meeting him, we introduced him to Hassa Hamaran, the lady, so that we encouraged him to go and witness to her where she was living. That was about 5 years ago. And after that, 5 years later, we went to Chad and we met him there. And he brought this patient to us to operate on in Chad, because Cameroon and Chad are next to each other, so we often see. And so he brought this patient, and oftentimes they cover their mouth, so we don't know how it is. So when he took off his cover, he had a big tumor in his mouth. He had this tumor for about 17 years, and after speaking to him, we prepared to perform surgery. And over there, every time for surgery operation, we need to find blood. And to find blood is very difficult to have blood. And I'm O positive blood, and my husband is A negative. So O positive, you can give blood at any time. So I have a vein right here that anytime that my husband needs blood, I would give blood to the patients. And after operating for him, and we removed the 12-pound tumor, the largest tumor that we have removed. And after we removed it, his mouth became normal again. And oftentimes we would put a titanium plate when we remove the jaw. But after removing the jaw and putting in the titanium, we have to have it to be hardened so that you can eat. So we have to take some bones from the hip to put in there to help the titanium to be strong. And then we operated a second time to use bone from that Americans make, which is like the fake bone, to also add to it. So it got enlarged, but after it healed, he was able to be healed. And this man came to know the Lord through the pastor Thomas. And after he came to know the Lord, he was baptized. And in the 17 years that he had this tumor, the family left him because they were afraid that they didn't have enough money and all. And so he lived by himself for 17 years in avoidance. And after he was healed, his family returned to him and apologized to him. And because he came to know the Lord, he was willing to forgive his family. But it was very difficult because 17 years apart. And so it was very difficult for him to return to his family. So now Pastor Thomas is taking care of him. And this is a picture of a reunion of Pastor Thomas and the two patients that he has led to the Lord. And the last story is this man in Mali. There was in that country there's an illness. It's called, I think, nomad. And if you don't have enough nutrients when you're a little baby, then it's easier for you to get diseases such as measles. And secondly, you can also have easily get a bacteria, and that bacteria starts to eat up the whole face. And this man is not as bad. Some people, it eats all the way up to their eyes, but he came to the hospital and asked to operate on. And we asked, why do you want to be operated on? And he said that I want to show off my face to my wife. And so after operating on, we used a skin on the top of the forehead here and put it down to the bottom. And it took 4 to 6 weeks for healing. And during the time that he was covered like that, in Mali, if you hear the news, about 2 or 3 years ago, northern Mali, Al-Qaeda was attacking, and they were traveling south, heading south. And when they the missionaries had to leave and go to another country. And while he was covered like that, we had to leave. And when he saw the team, and when he saw Tim come in to take out his operating tools, and he kept on looking, didn't understand, because he was afraid that we would disappear. And we went to Burkina Faso, and after 2 weeks, we asked to return to complete his job. And after that, we were not allowed to go back, but we tried to go back to complete the work on him. And so we returned and helped him and completed the operation and the process. And after about a month later, I think, or a year later, I'm not sure, but we went back and we heard that he came to know the Lord. And this is him sitting there. And oftentimes these operations takes about 2 or 3 times, and so he had to sit there waiting at the medical center for the operation, the second operation. This is when Tim and his friend went to visit him in his village. And the last verse that I would like to share is in 1 Corinthians 12, 7 to 11. Now to each one, the manifestation of the Spirit is given for the common good. To one there is given through the Spirit the message of wisdom, to another the message of knowledge by means of the same Spirit, to another faith by the same Spirit, to another gifts of healing by that one Spirit, to another miraculous powers, to another prophecy, to another distinguishing between spirits, to another speaking in different kinds of tongues. All these are the work of the one and the same Spirit, and He gives them to each one just as He determines. I know that God doesn't call everyone to leave their country to serve, but God calls us according to the abilities that He has given to us. We cannot go to Africa to serve and minister if people here do not pray for us and give so that we can serve over there. And we cannot serve over there if we don't have the pastors and the missionaries working together. Because if we had to say that we have to go to be in medicine and proclaim the word of God at the same time, we cannot do both. Because after operating for 8 to 12 hours, we're so tired, not even have time for our child. So other people go out to proclaim the good news, to go to these patients' rooms to talk to patients. And when these patients return to their village, there are other people who need to care for them. So this is the work of all people together of the family of God, not only in America here, but in other countries. I know that here, there's a lot of Vietnamese who take care of Vietnamese people, but in Mali, I discovered that there are about 30 people, Vietnamese people, who live in Mali. And when I go to Gabon, I also discovered there are some Vietnamese restaurants there. So the Vietnamese people are all over, not just in America or certain nations that we know. And in Africa, there's some Vietnamese, and so I will bring along some witnessing tracts to give to them. But I would like to remind us that when God called me into the ministry, I thought I was going to serve the Vietnamese. I went to Vietnam, but I was not able to stay there. And then I went to Cambodia to work with the Vietnamese for 5 years. And then all of a sudden I went to Africa. And I said, why is it God called me to serve with the Vietnamese? And now I had to follow my husband to Africa. But God told me that you are to go. Wherever God calls us, we are to go. And now there are many things such as Al-Qaeda and ISIS. And people worry about my family. Why we have to go like this? And I say that when God calls us, I'd rather go and live in the calling of the Lord than to live in outside of the calling of the Lord. Then I will be more fearful.